Good morning, all of you. My name is Chand Praveen Nandev. I am from Jalna. I recently passed out my Bachelor of Pharmacy in Dr. Babasaheb Ambedkar Technological University, Rayagad, Lonere. Today's topic is technical, and today's topic name is medical coding. The medical coding is the process of the converting of the healthcare disease, procedure, medical services, and equipment into universal medical alphanumerical codes. These are used by the healthcare providers, insurance companies, and the government agencies to manage of healthcare billing, claim, and the patient records. There are several types of medical coding system, each serving different purpose of the healthcare industries. Below in a detail explanation of the various types of medical coding. The first of all is ICD coding. ICD coding is the international classification of disease. The ICD coding is the system used worldwide classified disease condition and the health related issue. It is the updated periodically by the World Health Organization and is the standard coding system for reporting disease and healthcare condition for statistical billing and the clinical procedure. Types of ICD code. ICD is ICD-10 is a CM clinical modification. This is the coding system used by the United States diagnosis the ICD-10 CM. The codes used by the physician, hospitalists, and the outpatient of healthcare provider to document and classify disease of injuries and other healthcare condition. ICD-10 PCS, this used by the inpatient procedure in the United States, unlike ICD-10 CM, which focusing on diagnosis. ICD-10 PCS, the code used by the healthcare procedures performed during hospital admissions. ICD coding example, the cholera, then E119 type 2 diabetes mellitus without complication. CPT coding, current procedure terminology. The CPT is the maintained the American Medical Association and used by to code categorize medical procedures services performed by the healthcare provided. It is widely used in the United States for the billing outpatient physician services. CPT code is used to describe medical, surgical, and diagnostic procedure and services. The codes are divided into the three categories. First category is standard codes and procedure services. Second category is codes of tracking and reporting performance and measurements. Category 3, the codes of emerging technology services and procedure that are experimental and not yet widely used. Then CPT code example 99213, the office outpatient visit of the evaluation management established patient. Then 47562, the leprosy, the gallbladder removal. Then HPCS coding, healthcare common procedure coding system. HPCS is the code which represent the healthcare product supplies and services of the covered CPT and SCPs divided into two level. Level 1, the identical to the CPT codes and used by medical procedures, services, and supplies provided by the healthcare professional. Level 2, these codes are used in identifying non-physician and services product and the supplies such as travel, medical equipment, and imbalance of the services and certain drugs. Then HCPS level 2 codes are used medical and Medicaid track services covered by the CPT. Then code offset, especially in the outpatient setting. The HPCS coding example A0425, ground ambulance and transport expense transport. Then J33101, injection of the trimicolon acetonide 10 mg, etc. Then DRG coding, diagnostics related group. The DRG coding is primarily used in the inpatients and setting of the classify hospitals case groups that are expected have the similar hospital resource DRG codes and assign the patient the based on the diagnosis the procedure they are underwent in the factors of the age and the comorbidities. These codes are important hospital billing. They help determine the reimbursement of the amount of the medical code and insurance. Then DRG coding example DRG 291, heart failure and shock with the major complication. Then ICD-10 PCS coding, procedure coding system. Mention ICD-10 PCS codes are used by classify procedure that are performed in inpatient setting. These codes are a part of the broader ICD-10 system, are designed specifically impatients and procedure coding. The ICD-10 PCS system using even character alphanumeric codes describing procedure in great detail. ICD-10 PCS coding example 0FT44ZZ, research of the stomach open approach. It's all. Thank you watching for my video.